You're finally settling down after a long day, feet up, lights low, ready to rest. But something doesn't feel right. Your shoes were tighter than usual, your ankles feel puffy, and there's that subtle, dull ache you've been ignoring. You tell yourself it's the heat, or maybe just fatigue. But what if it's more than that? What if your body's trying to warn you that something's off? Swelling in your feet and legs may seem harmless at first, but it can be the early sign of something deeper. Nutritional deficiencies, sluggish circulation, or even stress on your heart or kidneys. Many people brush it off as a part of aging or standing too long, but recurring swelling is your body's way of saying, pay attention. And there's one vitamin in particular that might be missing quietly, contributing to your discomfort. In this video, you'll learn about one essential vitamin that plays a powerful role in helping your body reduce swelling in your feet and legs, something most people overlook. We'll also explore the real reasons behind recurring puffiness, discomfort, and heaviness in your lower body. From nutrient imbalances to daily habits you didn't know were affecting your circulation, we'll walk through every key factor you need to understand. And most importantly, we won't just stop at the why. We'll show you exactly what to do starting today. So, if you're ready to feel lighter, stronger, and more in control of your health, stay with us until the end. This might be the missing piece you've been waiting for. 1. Vitamin B12, the oxygen distributor. Vitamin B12 is essential for red blood cell production and nerve function. Without it, your body struggles to deliver oxygen efficiently, especially to your extremities. This poor circulation often results in swelling, numbness, or a heavy dragging sensation in your feet and legs. Many people, especially seniors and vegetarians, have low B12 and don't even know it. You might feel off balance, weak, or notice pins and needles in your legs that you blame on poor posture. But the problem may not be how you sit. It could be what you're lacking. So, where do you get it? B12 is found in animal-based foods like eggs, meat, fish, and dairy, and in fortified cereals. If your diet is low in these, or if your body has trouble absorbing B12, a supplement might be necessary. A common misconception is that all supplements are the same, but sublingual under-the-tongue B12 or B12 injections tend to work better for people with absorption issues. FAQ. Is a blood test the only way to confirm a deficiency? Yes, and it's a simple test worth asking your doctor about. Expert tip. Don't rely on symptoms alone. B12 deficiency can be silent for years before swelling and nerve pain show up. 2. Magnesium, the natural muscle relaxer. Magnesium is often called the calm mineral, and for good reason. It helps relax your blood vessels, support nerve signals, and regulate fluid balance. When you're deficient, your body holds onto water in the wrong places, like your ankles and feet. Swollen legs, leg cramps, and that persistent aching may be your body's way of saying it's running low on this mineral. Sadly, processed food diets are notoriously low in magnesium. You can boost your intake with foods like spinach, pumpkin seeds, almonds, black beans, and whole grains. If your legs tend to cramp or swell at night, adding Epsom salt soaks. A magnesium-rich bath solution may help ease that tension. One myth is that magnesium supplements work instantly. They don't. It takes consistency over days or weeks to notice a change. FAQ. Can magnesium reduce puffiness from water retention? Yes, especially when paired with good hydration and a low-sodium diet. Expert tip. Pair magnesium with potassium-rich foods like avocados or bananas to support optimal balance and blood flow. 3. Iron, the blood flow enabler. Iron is crucial for making hemoglobin, the protein in red blood cells that carries oxygen throughout your body. If you're low on iron, your tissues, including those in your legs and feet, don't get the oxygen they need. This can cause swelling, fatigue, pale skin, and even pain when walking. People often associate iron deficiency with anemia, but mild deficiencies can still lead to significant symptoms long before anemia is diagnosed. Cold feet, leg cramps, or an unexplained sense of heaviness might actually be your body flagging low iron. The good news, iron-rich foods are easy to find. Lean red meat lentils, spinach tofu, and chickpeas are great choices, but absorption is key. Your body absorbs iron better when it's paired with vitamin C, so squeeze a little lemon on your spinach or have citrus with your beans. Many people assume iron supplements are safe for everyone, but overdosing can be harmful. Always talk to your healthcare provider before starting iron supplements. FAQ: is plant-based iron enough? It can be, but vegetarians need to be especially intentional about pairing it with absorption boosters. Expert tip: if your blood work shows low ferritin, not just hemoglobin, it's a sign your iron stores are depleted, even if you're not anemic yet. 4. Vitamin D, the anti-inflammatory agent. Vitamin D does more than just strengthen bones. It's a key player in reducing inflammation and regulating your immune response. When your vitamin D levels drop, chronic inflammation can quietly build up in your body, especially in your joints and soft tissues. This includes the tissues in your feet and legs, where swelling may become a recurring problem. You might notice your legs feel puffy, stiff, or unusually sore after a normal day. While sunlight helps your skin produce vitamin D, people over 60 often lose the ability to synthesize it efficiently. Add in limited sun exposure or a diet low in fatty fish and fortified foods, and deficiency becomes more likely. Unlike magnesium or B12, symptoms of low vitamin D are subtle. It's often missed entirely. A simple blood test can tell you if you're deficient. But don't go overboard. Excessive supplementation can lead to other health risks. FAQ: can taking vitamin D actually help reduce leg swelling? Indirectly, yes, it reduces underlying inflammation that leads to fluid retention. Expert tip: pair vitamin D with healthy fats like olive oil or avocado for better absorption, and always take it with a meal. 5. Edema, the common culprit behind puffy feet. Edema is a medical term for swelling caused by fluid trapped in your body's tissues. It's one of the most common and overlooked reasons why people feel tightness or puffiness in their feet and ankles. Edema can be mild or severe, short-term or chronic. You may see indentations in your skin after removing socks, or notice that your shoes feel tighter by evening. Edema isn't a condition by itself, it's a symptom. It could be linked to standing for too long, sitting all day, high salt intake, or deeper issues like kidney, liver, or heart dysfunction. Managing edema means treating both the symptom and the root cause. Start by reducing sodium, staying hydrated, and elevating your legs for 20 minutes daily. Wearing compression socks can also help, especially during travel or long work shifts. FAQ: does edema mean I have heart failure? Not necessarily, but if swelling is persistent, accompanied by shortness of breath or fatigue, see a doctor. Expert tip: check your skin. If pressing leaves a dent for several seconds, it's likely pitting edema and needs attention. 6. Foot or ankle injuries, the localized sweller. Not all swelling is systemic, sometimes it's local, and injuries are a prime example. A twisted ankle, stubbed toe, or even a minor strain can cause one-sided swelling that's warm, tender, and hard to ignore. The problem is, many people dismiss these signs as just a bruise or a little sore, only to later face chronic inflammation or stiffness. Acute injuries trigger your body's healing response. Blood rushes to the area, tissues become inflamed, and fluid accumulates to protect the joint. While this process is natural, prolonged or excessive swelling may indicate something more serious, like a torn ligament or stress fracture. Immediate care is key. Use the RICE method. Rest. Ice compression and elevation. Avoid putting weight on the injured foot for at least 24-48 hours. Over-the-counter pain relief can help, but if swelling persists for more than a few days, consult a specialist. FAQ: should I wrap my foot if it's swollen? Yes, but not too tightly. Wrapping helps reduce fluid buildup, but poor technique can cut off circulation. Expert tip: don't push through the pain. Healing takes time, and rushing back to walking or exercise too soon can make things worse. 7. Pregnancy and hormonal shifts. The circulation slower. During pregnancy, your body retains more fluid, your blood volume increases, and your veins are under extra pressure, especially in the lower half of your body. That combination often leads to swollen feet and ankles, especially in the third trimester. But it's not just about pregnancy. Hormonal shifts like those during menopause or monthly cycles can cause similar effects. Estrogen impacts water retention and blood vessel flexibility, which means hormonal fluctuations can make you feel bloated or swollen in your legs even when your activity level hasn't changed. Many pregnant women assume it's just part of it, but there are smart ways to reduce the discomfort. Elevate your feet above heart level whenever possible. Avoid standing or sitting for long stretches. Stay cool, stay hydrated, and avoid salty foods. Comfortable, supportive footwear is essential. FAQ: is swelling during pregnancy always normal? Not always. If it's sudden, painful, or accompanied by headaches or blurry vision, it could be a sign of preeclampsia and requires immediate medical attention. Expert tip: sleeping on your left side can improve circulation and reduce swelling during late pregnancy. 8. Medication side effects. The hidden trigger. Many people are surprised to learn that common medications can quietly cause fluid retention and swelling, especially in the feet. Drugs like calcium channel blockers for blood pressure, corticosteroids for inflammation, antidepressants, diabetes meds, and hormone therapies can all disrupt your body's balance of salt and water. Some cause blood vessels to widen, making fluid leak into surrounding tissues. Others affect kidney function, leading to sodium retention. The result? Puffy feet, tight shoes, and that heavy leg feeling at the end of the day. If you've recently started a new prescription and noticed swelling shortly after, it's worth discussing with your doctor. Never stop a medication on your own, but your provider may adjust the dose or switch you to a better alternative. FAQ: how do I know if my meds are causing the swelling? If symptoms began soon, after starting a drug, and improve when it's paused or replaced, that's a clue. Expert tip: keep a medication journal. Track when symptoms appear and correlate them with new prescriptions or changes. It's a powerful tool for you and your doctor. 9. Hot weather and dehydration, the summer sweller. When the temperature rises, your body tries to cool itself by dilating blood vessels. That's helpful for regulating heat, but it also makes it easier for fluid to leak into nearby tissues, especially in the legs and feet. Add in dehydration, and your body holds onto whatever water it can, often in all the wrong places. If your feet swell every time summer rolls around, or if you notice that walking outside makes your shoes feel tight by midday heat, could be the culprit. Many people think drinking less water will reduce swelling. It actually does the opposite. Dehydration thickens your blood and strains your circulation, leading to even more fluid retention. The solution is simple: hydrate, elevate, and ventilate. Wear breathable shoes, avoid standing on hot pavement for long periods, and cool down with fans or AC whenever possible. Soaking your feet in cold water also helps. FAQ: why do my feet only swell in the summer? Because your veins are expanding more than usual, and if you're not hydrated or moving enough, fluid pools downward. Expert tip: add electrolyte water or a pinch of sea salt to your hydration routine on hot days to keep your mineral balance steady. 10. Chronic conditions when swelling signals something bigger. Swelling in your feet may seem like a minor annoyance, but sometimes it's a warning light for more serious health issues. Conditions like heart disease, kidney dysfunction, and liver problems can all cause fluid to pool in the lower body. When the heart isn't pumping efficiently or the kidneys aren't filtering properly, excess fluid builds up and gravity sends it straight to your feet and ankles. You might also notice shortness of breath, fatigue, or rapid weight gain. Some people mistakenly treat the swelling with creams or foot massages, unaware that the root problem lies much deeper. If swelling happens regularly, especially in the morning or without an obvious cause, it's time to get checked. Blood work and imaging tests can detect underlying organ stress before it turns into something worse. FAQ: how do I know if my swelling is caused by my heart or kidneys? Look for additional signs like breathing trouble, persistent fatigue, or puffiness in the face or abdomen. Expert tip: if you're over 50 and dealing with chronic swelling, get a full metabolic panel once a year. It could catch problems early. 11. Blood clots and deep vein. Thrombosis DVT, the silent threat. One-sided swelling in the leg, especially if it appears suddenly, can be a sign of a blood clot, a condition that should never be ignored. Deep vein thrombosis DVT occurs when a clot forms in a deep leg vein, blocking blood flow and causing swelling, warmth, and pain in the affected area. The danger: that clot can break loose and travel to your lungs, causing a potentially fatal pulmonary embolism. Many people think DVT only happens to older adults or those with major surgery, but it can affect anyone, especially those who sit for long hours on planes or work at a desk all day. If your leg looks swollen, feels hot, or aches, when walking, don't wait. Seek immediate medical attention. FAQ: can DVT happen even if I'm active? Yes. Dehydration, genetics, hormone therapy, and certain medications can still increase your risk. Expert tip: if you've been sitting for over 2 hours, get up and move. Even a short walk or calf stretch can dramatically lower your risk. 12. Lymphedema, when the lymph system fails to drain. Your lymphatic system is like a drainage network for your body. It clears out toxins, waste, and extra fluid. But if it gets damaged or overwhelmed, that fluid has nowhere to go, leading to chronic swelling known as lymphedema. This condition often affects people who've undergone cancer treatments, especially those involving lymph node removal or radiation. But it can also develop from infections or injuries that disrupt lymph flow. Lymphedema typically causes one-sided swelling, a tight or heavy sensation, and skin that feels thick or firm. Unlike edema, which can come and go, lymphedema tends to stick around and worsen over time without treatment. Compression garments, targeted massage, called manual lymphatic drainage, and specific exercises can all help move the fluid. Left untreated, lymphedema can lead to skin infections or even permanent tissue damage. FAQ: can I cure lymphedema completely? No, but you can manage it effectively and keep it from progressing. Expert tip: don't wait until swelling gets severe. Early intervention makes the biggest difference. 13. Heart disease, when your heart can't keep up. Your heart is responsible for pumping blood throughout your body. When it weakens, especially the right side, it struggles to return blood from the lower limbs back to the heart. The result: blood pools in the legs and feet, causing swelling, heaviness, and often a sense of pressure. This kind of swelling is especially noticeable at the end of the day and may improve slightly in the morning. But don't ignore it. Persistent leg swelling could be a red flag for congestive heart failure. Other signs to watch for include shortness of breath, rapid heartbeat, chronic fatigue, and nighttime coughing. Too often, people chalk these symptoms up to aging or being out of shape. But your body is trying to tell you something important. If you're experiencing multiple symptoms, schedule a checkup right away. FAQ: can swelling in my legs be the first sign of heart trouble? Absolutely. It's often one of the earliest signs in older adults. Expert tip: track your weight daily. Sudden gains over 2 to 3 pounds can indicate fluid buildup related to heart failure. 14. Kidney disease, when waste and water stay behind. Your kidneys help filter excess fluid and waste from your bloodstream. But when they aren't working properly, fluid backs up, often showing up as swelling in your lower legs, ankles, and even your face. The scary part is that kidney dysfunction can be silent for years, with swelling being one of the first visible signs. You might also notice foamy urine, decreased urination, or fatigue, but many people miss these subtle changes. Chronic high blood pressure and diabetes are the two most common causes of kidney damage. If you already have either condition, it's crucial to stay alert. Treating kidney-related swelling involves more than drinking water. It may require medications, a low-sodium diet, and even dialysis in severe cases. FAQ: does swelling always mean kidney failure? No, but it's a sign you shouldn't ignore, especially if paired with other symptoms. Expert tip. Ask your doctor to test your GFR glomerular filtration rate and creatinine levels. Simple blood tests that can reveal how well your kidneys are functioning. 15. Liver disease, when your body loses its balance. The liver is often overlooked when we think about swelling, but it plays a key role in maintaining fluid balance. It produces albumin, a protein that keeps fluid from leaking out of blood vessels. When liver function declines, albumin production drops, and fluid begins to seep into surrounding tissues, especially in the legs, feet, and abdomen. This is common in conditions like cirrhosis or hepatitis. Other warning signs include yellowing of the skin, jaundice, dark urine, easy bruising, and nausea. People often don't associate foot swelling with liver disease, but it can be one of the earliest clues. If your ankles are constantly puffy, your belly feels bloated, and you're experiencing digestive issues, your liver could be under stress. FAQ. Can lifestyle changes really help with liver-related swelling? Yes, reducing alcohol, managing weight, and eating a liver-friendly diet can make a big difference. Expert tip. Avoid self-medicating with herbal supplements. Some may harm the liver further. Always consult a doctor before adding anything new. If your feet and legs are swelling regularly, the time to act is now, and it doesn't require an overhaul of your entire lifestyle. Start small. First, schedule a checkup with your doctor to assess your levels of vitamin B12, iron, magnesium, and vitamin D. These 4 nutrients are the most common hidden deficiencies behind lower body swelling. In the meantime, begin your 14-day leg relief plan today. For the next 2 weeks, make it a habit to elevate your legs for 20 minutes every evening. While you're at it, swap salty snacks for potassium-rich alternatives like bananas or avocados, and add 1 magnesium-rich meal to your weekly menu, like sautéed spinach with almonds. Don't forget to hydrate. Drink enough water so your urine runs light yellow, especially on warmer days. If your swelling tends to spike after sitting, set an hourly timer to stand, stretch, or walk around your home or office for just 2 to 3 minutes. These tiny changes may seem simple, but they carry long-term impact. Remember, you don't need to chase perfection, you need consistency. And here's something you deserve to hear: what you're doing right now matters. The fact that you're here, learning about your body, listening to its signals, and looking for answers means you're already on the right path. Many people ignore what their body tells them until it becomes a crisis. But not you. You're choosing awareness, action, and care. That's powerful. The road to healthier legs isn't built in a single day, but each small step you take, each better choice you make, is laying down a foundation for freedom, strength, and confidence in your body again. So, give yourself credit. You're not just fixing a symptom, you're showing up for your health. That's the kind of momentum that changes everything. If this video gave you clarity, motivation, or just made you feel seen, give it a thumbs up. It helps more people like you discover the answers they've been searching for. And if someone in your family or community has been silently struggling with swollen legs or chronic fatigue, share this with them. You never know whose life you might improve with a simple link. Subscribe to our channel for weekly health insights that are honest, practical, and built for real people with real lives. And don't forget to hit the notification bell so you never miss a tip that could change your day or your life. Let's keep walking forward together, healthier, wiser, and one step stronger.